Hey there YouTube, this is Dr. Greenfun here, and I just want to show you my do-it-yourself tattoo removal. Basically, what I did is I used dried ice. I've only read about it online in only a few articles. I've never seen any videos on it, so basically this is pioneer stuff, I guess, on YouTube. So I hope you'll get some information on it, and I will show you further progress in my healing here. So basically what I did here is I used dried ice, and I touched the skin for a little bit at a time, no more than a second, and I took dried ice and I smashed it into like a point, sort of like a pencil point, and then drew on these lines, okay, and that there is a scab. I just washed my hands, and it gets kind of soft, and it'll harden up again. Basically, I don't really know what the full effect will be, but it looks to me like this will be completely gone. Only one treatment. So far it's been about 2 weeks, and in 2 weeks, it blistered, and I cut the skin from the blister just so I could get to this layer of skin here, and then right here actually the blister remained, so maybe that's why it's not completely gone right there, because over on this side it's gone. See, it's pretty much gone. It was a little bit hard to keep, clean. It's on your hand, my finger, and as you can see, I did get a little bit burned there. I was careless trying to get into there. The total cost of it was only $1.19 for the dry ice, because it's by the pound at my store in Publix. And I'm not saying that you should do this, but what I did is I drew over it for a second, and then I would let it kind of warm up again, and then I'd go over the words here. With the words, I held it down for 8 seconds, like 1, 2, 3, 4, 5, 6, 7, 8, and then pull off. And I would never just let it sit there. I'd always wait for the skin to get back too warm, because it will freeze. It freezes your skin. It's so cold. So it's like a reverse burn. It's so cold that it burns your skin. The reason I'm removing it is because it's on my hand, for one. I'm not married, and it's not professional in my line of work, and I don't have like $500 to spend to get this removed. So, and this is what I was using to cover it up, and it's very uncomfortable, and it's just no good. So it doesn't hurt. Well, the actual procedure does not hurt, okay, but I was very mindful, because I didn't want to lose nerves. I didn't want to damage my nerves. And I think it was pretty successful. I had full sensation. I feel this. It can hurt from time to time, but I think it's just because it's of the location. because there's, veins and everything in your hand. It did go, deep enough down I believe, where it was like that. This is a big scab, and I can touch it, and it's hard. But I mean, I'm holding the camera with the other hand, so I hope that this helps here. This is about 2 weeks into healing time, and what I use to keep it clean, hot water, daily showers. I wouldn't really mess with it too much. Hand sanitizer, I used iodine, rubbing alcohol, and for a little bit I used hydrogen peroxide, especially on the very initial treatment when the blister had formed. What I did was I let the blister form, and it was basically where you see the area, that was where the blister was. I cut that away, and that did not hurt. There's been no blood in this whole entire thing. Okay, there's been plasma discharge, and like I said, that's a big scab there, and I think that it'll just peel away, and it'll be pink underneath like that, which will eventually turn to my regular skin tone. So I'm thinking minimal scarring as well, and a low cost, and I don't say do this, because you don't know the full effect, and as you can see, there's a high risk of infection, and I'm not condoning to do this, but I do think that, if you are knowledgeable in first aid and have the means necessary, and I'm not saying to do this on your midsection or anything, in any large body part, but maybe if you have my situation on your hands, possibly, maybe somewhere where there isn't, vital organs, somewhere on your extremities, possibly on your arms. I don't know. This is experimental. So if you have a finger tattoo like I do, this may help. Again, I'll keep you posted on what happens, but I do believe that that's basically all that's going to be left right in there. That should be all gone, and maybe just a little bit where that meets, that might be a little bit there, but other than that, it's completely gone on that side, and I didn't get on that side, so we'll see what happens. Anyways, please subscribe, comment, meaningful comments, and have a great day.